Well, Manny, we covered a lot of topics, and I know that these are important terms. I know the cannabis world can be confusing. But before we jump into, let's jump into some questions. Let's answer the questions that people submitted prior to the webinar, and actually webinar questions that we have received during the webinar. But I also want to do, before I do that, tell us a little bit about you. Tell us about the Blunt Life, because you do a lot of good work.
Absolutely. Thank you, Mark. And thank you, everybody, for participating and listening in on this webinar. My name is Manny Alfinez. I'm the founder of the Blunt Joint Life. And what we do is offer information to everybody and anybody from physician liaisons, physicians themselves, instructors, consultants, dispensary associates, and the general public. And it's all free. All we want to do is get that information out and get that journey started for you so you can find your way and also assist you through that journey. Again, from anything from A to Z, cultivation, how to use it, terpenes, cannabinoids, how to navigate dispensaries, how to get started. You name it, we offer it, and we're available online.
So Manny, let's jump into some of the questions that are there. I know that we've had some pre-submitted questions. And by the way, I want to, before I do that, I'm getting ahead of myself. I want to thank you for the work you do, because you help a lot of people. And I want to mention to our audience that if you do need some help with medical cannabis, not only am I available, but Manny's also available. And the Blunt Joint Life is something you should probably take a look at, and I'm going to promote. Now, let's jump into some of the pre-submitted questions. One of the first ones we have is what are the best products for anxiety and migraines? And Manny, I'm going to have you help me answer this. But before I jump into that, I want to also mention it's not a matter of the best product. It's a matter of what the products that you're going to use. And we're going to talk about, for example, we're going to talk about terpenes, which is critical to identify the best products. But also, I want to mention the route of administration, whether that's vaping, whether it's tinctures, topicals, edibles like gummies. These are also important considerations to make sure that that route of administration, that what you're using, you're comfortable with. And the question is, what in that route of administration, what am I looking for? And in many cases, what we're looking for is the terpenes. Manny, do you want to take us through the terpenes that they should be looking for?
Sure. And to your point on that, Mark, you also want to remember that it's not as simple as just anxiety and migraines. Here at the Blunt Joint Life or at MMTC Marijuana Aware, we'll probably dive in a little bit more like, okay, are you dealing with it during the day? Are you having your anxiety and migraines at night? What is your quality of life? What is your active life, if any? So we take all these things into account in order to make sure we get you the right product. So you're not too intoxicated, too high or euphoric. You can still function during the day or possibly get too high or too euphoric so you can help sleep and get rid of that anxiety and migraines. And to follow up on that, the terpenes really dictate the effect of how a product's going to work for you. So dealing with anxiety, limonene is great for that during the day. Linalool is better for it at night, along with myrcene. Those two pair up really well and also allow more THC to be absorbed in the body, so you get that full body effect. And then for the migraines, the same thing, but caryophyllene, B-caryophyllene, is actually really good for any type of pain because of how it reacts with your body. So finding these specific terpenes and what time of day or how you're trying to use it for what purpose is going to dictate what products you will use. And what I mean by products, what it is to suggest whether it's going to be an inhalant, an edible or oral, sublingual, or a combination of some at the same time to specify on which chemovar or strain, if you will be best for you.
Right. And going through your dosing process, you'll understand your tolerance to cannabis, to THC. And I noticed in many patients that I work with that are treating themselves using cannabis for anxiety, they're using a ratioed product with higher amount of CBD than THC, a 2-to-1, for example, 2 or 4-to-1, maybe even a 12-to-1. In fact, most people are more in the 9-to-1 and 12-to-1 categories of 9 THC to 1 THC, 9 CBDs to 1 THC or 12, because that really helps quite a bit. You've seen that in your consultations.
Absolutely. And CBD is actually really good for it. I think the only caveat is a lot of people don't realize that it could take a couple of weeks sometimes for it to build up in your system and give you the full effects. And that's why questions such as when do you feel pain, what are the symptoms are you dealing with, what is the source, what is your environment, all play in that role. And it makes a huge impact to determine what's going to be most effective.
Right. And I should also point out that recently, in fact, just released about 4 months ago, was a study out of Germany that showed that, and actually definitively proved for the third time, that in many cases, migraines are due to a lack of endocannabinoids in the body. And by being able to put those endocannabinoids back in there, two things happen. It lessens the effect of the migraines. In other words, it mitigates some of it, and if not preventing them from happening at all. So this is where using cannabis can not only help with migraines, but might even stop them from happening. And I've seen that happen in many, many, many cases. That's there.
Absolutely.
Let's run into the second question. Let's take on the second question. I have serious medical issues from being hit by an SUV as a pedestrian. I desperately need help in New York, and registered doctors refuse to help. First, I want to say I'm very sorry. Auto accidents are not fun. I was rear-ended, and my herniated discs in my neck come from that. And I think that really getting help is important, especially medical cannabis can probably help with, let's say, pain, inflammation, if not the anxiety and stress and the PTS from that particular incident. Now, I'm going to defend the doctors for a moment. Doctors are not trained on the endocannabinoid system, and they're not trained on cannabis when they're in medical school. So when you go to a doctor and you bring up the term cannabis, that's something they know nothing about. And because their license depends on their advice, they typically won't talk about it. They don't recommend it. I have found that over the 10 years I've been practicing, doctors are really warming up to or sending patients to medical cannabis practitioners like myself and Manny to really help with that particular situation. So I think the issue really boils down to a couple of things. First of all, a regular doctor is going to refuse your help because he just doesn't know, and he's not going to put his license in risk. But there are medical cannabis practitioners that can help you in the state of New York that's really there. How do you find them? Well, I think one of the things that you can do is go to your local dispensary, because your dispensaries normally have a list of doctors that prescribe medical cannabis or know something about medical cannabis or can help you be able to address medical cannabis for your particular need. Manny, your thoughts on this? Because I think it's important that, especially in New York, you get some local help.
I completely agree. And I would even go as far as to say that even physicians in states that are possibly recreational and or medical, there's very limited information that doctors will provide for that very reason, that is federally illegal, and they don't want to jeopardize their license based on the recommendation, not prescription that they're giving. And there's the caveat, because if they recommend it, they're recommending you to try it. They're not prescribing what to try, how to try it, what symptoms are you dealing with, and the frequency because of those symptoms. So it's hard pressed, but you can find medical practitioners or other regular doctors even that might be. What I would suggest is do your research, follow these rabbit holes that medical marijuana awareness wellness, provides, so you can kind of navigate it on your own without necessarily needing the doctor to recommend the product, but only for the follow-up. And the biggest problem I think you're probably running into in New York, a lot of the products there are imported. They're not really a seed to sale type vertically integrated state where they're tracking it and telling you exactly what's in that product. So it makes it a little bit difficult to navigate, but you can always reach out, get those consultations, let us find more information out about you or your local physicians that are willing to tell you about it, that are informed about it. But it is a lot of research, and I think following us here and doing your research through what we provide might help give you some insight and at least help you be informed to ask the right questions and find that professional physician or medical physician that would be able to assist you.
Yeah, and I think also going back to a lot of the dispensaries have contacts or have medical cannabis practitioners that can really help you with these particular situations. So I'd kind of head in that particular direction. And if need be, get a hold of some organizations like Normal, because Normal has a list of doctors that you can take a look at. Actually, a list of cannabis practitioners as well that can help you with this, especially in multiple states like New York. I hope that answers your question. And if you need more information about that, please send an email to events@marijuanaaware.com. We'll see if we can continue to answer that question. We want to really get you some help. One next question is a higher dose always more effective? And I hate to be a buzzkill, but I think the answer is no. Manny, do you want to take this one?
Absolutely. And I'm glad, I love the way we work together, because I was just going to bring up the biphasic effect. And here's the chart. That's to suggest that drinking more alcohol is going to make you feel better. And that's just not the case. Biphasic meaning that you have a subtherapeutic range, a targeted range, and then a toxic range. And depending on the dose you take is going to dictate where you're at. We always, always, always advise start low, go slow. If your tolerance is building up, then you may need to take a tea break, a tolerance break, or what we call a holiday. You can take CBD while you're doing that to help ease your symptoms coming back on. But if you're having little effect as it is with high THC products, this would be the perfect example. And if you've found a sweet spot on a high dose, like dabs, for instance, that's going to boost that tolerance so high that other products may not be as effective. And even the dabs may become ineffective because your tolerance is spiking. And that's where a tea break, tolerance break, or holiday would come into play. But trying to keep it in that target range is the goal, what we want to get you at.
And that holiday is taking between 1 to 4 days off. That's what's really important. And I should point out, what happens is your body resets. Your endocannabinoid system gets kind of lazy because it's being given cannabinoids. It doesn't have to produce them. And so when the cannabinoids aren't there, they have to go back to work, put it that way. You basically wake them up and get them working again. And they recommend typically about 4 days to be able to take that break. Now, I do have to tell you, in my case, I have herniated discs in my neck. I go about a day and a half, and my neck taps my shoulder and says, "If you don't do something pretty quick, cowboy, I'm going to let you know I'm here." So whatever tolerance break you can take it. Don't take it to the point where you're back in pain and causing yourself discomfort. But just take it long enough that your body can reset. I think that's an important thing.
Absolutely. And I'd like to point out also that we've been talking a lot about endocannabinoids and cannabinoids. When we say endocannabinoids, what that's suggesting is from within. Our body naturally produces what's called 2-AG, which is very similar to CBD, and anandamide, which is very similar to THC. So by consuming cannabis, you're actually supplementing those cannabinoids or endocannabinoids that you may be low on. And those cannabinoids from the plant are actually called phytocannabinoids, just to
Mhm.
give a little clarification.
Let's jump into the next question, which is a really good question. It says, "I have an active card and prescription/recommendation, but I need a higher dosage. Is there a higher dosage available with my existing prescription? I need to discuss this with my doctor." I think you kind of covered a little bit of that in the video, Manny.
Yeah, absolutely. And typically I deal with this quite often. And about 7 out of 10 times, what I find is not necessarily that they need a higher recommendation or a higher dosage. What they need to do is apply their dosage appropriately. So what I mean by that is if you're finding little effect, particularly with edibles or orals that you're consuming, because those are a little bit more impactful with 11 hydroxy THC as it converts in our body. If you're taking it on an empty stomach, you're going to get a delayed response. It may take longer to actually take effect on your body, and it may not be as potent as you may need. I always tell people if you're dealing with situations like that, particularly edibles or orals, try to have a small snack before something fatty. That's why you see a lot of edibles as cookies and chocolates and brownies, because that fatty content helps it get into the body a lot better. If
Mhm.
you're using inhalants, just changing it up may make the difference.
Changing your route of administration may help a little bit. Taking your time to be able to understand what your current dosing level is, and if it helps affect if it's being effective, and if it's not being effective, try some variations. Again, if that doesn't work, talk to your doctor. Now, your doctor can request a higher recommendation. He can actually get you more product if you really need it, and that's what a doctor's form is all about. But varying it, and also time of day, and if you've eaten something or have something fatty something in your stomach, yogurts or something like that can really help. So hopefully that helps a little bit answer that question. Next question is, how do I get a medical marijuana card in Florida, and what is the cost? Um, I think this is a question we hear quite often. The step of getting a medical marijuana card in Florida is really a four-step process. The first process is, do you have a qualifying condition? Now, I do have to tell you, although there are 12 qualifying conditions here in Florida, you'll find that as long as you have a condition that's similar to the condition that's part of a qualifying condition, you can get a card. And this is where the doctors make that decision. So if you don't have one of the 12 that's in the Florida recommended conditions, don't stop. Talk to your doctor. In my case, I have herniated discs. Herniated discs are not one of the 12, but chronic pain is. And by going to my doctor, he's able to get me my card by using chronic pain as one of the conditions to be able, so I qualify in that particular area. So, and if you don't qualify, your doctor will not charge you for the visit. That's the normal mantra of most of the medical marijuana doctors here in Florida. I recommend using medical marijuana treatment clinics of Florida because they follow that policy and they do a great job of support. Not a matter of just getting your card, it's a matter of the support that you get afterwards. And
If
what
I
you really
may,
want to do is you want to find out if you have a qualifying condition, get an appointment, find a doctor, make an appointment with them, complete the application with the registry, and then what you're doing is you're filling your order in the Florida State dispensary. Manny, you had some comments and thoughts on this.
Yeah, I was just going to mention that also keep in mind that there's no referrals, there's no insurance. This is really a personal journey. So I always recommend that persons do their due diligence as far as calling around. You can even visit a dispensary, you can visit and check out the clinics, and check out the reviews and stuff. MMTC is phenomenal. That's why I work with you all. I loved what you do. It's very few and far between to find medical physicians or qualified PAs that will actually give you what you're looking for, especially if you don't know what questions to ask or how to navigate it. And that's why I love doing this and what we're doing, Mark.
Yeah, I think it's really, really important. Don't be shy. Ask questions. I find that most people in the cannabis business are really here to help. And in our case, we're here with this webinar to really help people get their life back. So don't be shy. I mean, you'll find that a lot of people will give you the information that you really, really need. Now, the question also is, how do I get a medical card in Georgia? Pretty much the same issue. Find a medical marijuana doctor. Again, MMTC is called True Relief in Florida. Excuse me, MMTC is called True Leaf in Georgia. We'll actually send you some information on this so you can be able to get contact with them. They have offices, they have cards that are there, they have doctors that will get you a card. And once you get your card, same thing, they'll qualify you to be able to go to a dispensary and talk to them. So it's the same process almost in every state. Difference is, how do you find the doctor? And really the difference is the limits of what the state will let you use, and also the limits the state puts on the dispensary as far as the amount of quality of the THC that you put in place. For example, in Texas, very low amount of THC. So if you have a condition like pain, you have to buy quite a bit of product in order to be able to address that. Where in states like Florida, you can buy just one product to be able to do that. Georgia, again, really restricts the amount of THC in the product. So you may have to buy a little bit more. And that kind of bothers me a little bit because they should really let the doctors do the job of regulating what the patient takes, like they do with pharma drugs. But unfortunately, in the medical cannabis business, politics plays a major role in that. So feel free to get a hold of MMTC in Florida or True Relief in Florida and in Georgia, and they'll be able to help you quite a bit. Well, let's jump into some other questions that are out there. I have a lukewarm opinion of Medicare providers who support, tolerate. Let me try this again. I have a lukewarm opinion of primary care providers whose support and tolerance of marijuana is only as adjunct to their plans. What are your thoughts on that attitude? First of all, as I mentioned earlier, doctors aren't trained on cannabis, and they really don't want to put their license in jeopardy. I have found that doctors also want to be the authorities. Right? I've had a few, I would say, confrontations with my doctor relating to cannabis because I know that cannabis works very effectively on certain conditions, and he is hot to prescribe pharma drugs that candidly aren't good for me. So we have discussions about that. I have found that in my discussions with many of my doctors, a couple of my doctors I've had these conversations with, I've turned them completely around. They are now very supportive of medical cannabis and in fact send me patients. So what I'm trying to point out is my attitude is we need more education. People need to understand that we went through a period where candidly the federal government vilified cannabis, and really that's not the case. For 5,000 years, it's been a product that people have used effectively and are using effectively today. I just think what you need to do is have a candid discussion with your doctor, and if he's not open to it, find another doctor. I know that there are doctors out there that are very open. They may not know about cannabis, but they're open to you using cannabis, and they have a better attitude. Your thoughts, Manny?
I completely agree. This kind of is a play off of what we were mentioning earlier about physicians. And we try not to demonize them, or at least not to portray that, because again, they don't know, they can't learn, they can't know because of the federal government. Right. And so they're trying to protect themselves in a sense. The kind of same thing happens with the VA, which we'll have another seminar or webinar about that later. But yeah, call around, talk to the associates that are there at the clinic, because 9 times out of 10, you're also going to get more education from the cannabis consultant that's there rather than the physician. And I always use the metaphor of like when you go to a regular primary care provider, as you suggest, you deal more with the nurse rather than with the physician. The physician comes in and reaffirms what the nurse said or did, unless they have to put hands on themselves, and then they walk out after 3 to 5 minutes. Not a bad thing, but it's just the way the system works right now. And the only way around that is just calling around and doing your research, as far as I know.
Manny, this next question is one that's a trick question for you. Um, how does a patient calculate possession limits? How many eighths is 2.5 ounces?
That is a wonderful question, and it is a trick question because each dispensary submits an application for what they're trying to provide to the state, and then the state approves it. So you'll find some eighths of an ounce at 0.123. You might find grams or milligrams. You'll find some at 1.25. You might find a little different variation there, and that does really wreak havoc on the system as far as calculating how much you can have at any given time. Same thing, particularly with pre-rolls. Pre-rolls can throw off that calculation where you might be left with or be short by 0.23 to get another eighth, but because that 0.23 is there, you can no longer purchase it. So the question is, how many eighths is 2.5 ounces? Roughly 20 eighths. Each eighth is 3.5 grams. So 2 of those would be a quarter, 4 would be a half, 8 would be an ounce. And then you calculate it that way. You can always request or have a discussion with your physician to see if you can up those limits. Those are called what we call a request for exception, or RFE. There may be some fees implied with that depending on the appointment alignment. However, they submit that to the state. The state either approves or denies within 10 business days. You'll get an email. And most of what I see the increase go to is about 4 ounces. It can go higher, but the determination is based on your discussion with your physician.
Sure. And on the right here, you see a little chart that comes from when you get your medical marijuana card. This is a portal that you have access to, and this is where you have your possession limits and where you currently stand with respect to them. You use that quite a bit in the dispensaries.
Absolutely. Dispensary. This is basically like if you go to a pharmacy, the pharmacy looks up your stuff and what's authorized. This is what a dispensary uses, and dispensary dispenses against what recommendation you have left. And you can always, again, have a discussion with your physician and have some milligrams shifted around. Your flour is going to be in ounces. Everything else is in milligrams. And if you don't use, let's say a lot of people don't use what we used to have suppositories. Most dispensaries got rid of those because they weren't selling or just not as much recommended, excuse me. So
Mhm.
people would get rid of their suppository recommendation and have it dispersed or added on to one or throughout all their other routes. So it gives them a little bit more to deal with within a 70-day period. For everything other than flour, flour is going to be in a 35-day period.
Let's jump on to the next question. This is kind of a fun question. Have medical marijuana gummies been shown to be addictive? First of all, let me define the word addictive. Addictive means that you're in a situation where you cannot um, stop from doing something. I have to tell you, I have herniated discs in my neck. Uh, Cannabis allows me to live in a level of pain on a scale from 0 to 10, of 1 or less. I am not addicted to cannabis. I do use gummies. I use other forms of administration, but I'm not addicted to them. What I'm addicted to is getting rid of my pain. And I have not found a better remedy, either a pharma drug or any other remedy that works more effectively to get rid of my pain and the inflammation than gummies. Now, I do have to tell you, there are people that love the gummies because they taste good. They're easy to carry, they're easy to use. And I know in certain cases they work. And so people get addicted to the fact they take a gummy and they feel good. And that's what they're addicted to, is feeling good. You can stop at any point in time. And the reason I made that definition about addiction is with opioids, it's very, very hard to stop because it makes a chemical change to your brain, requiring you to want, desire, and need more opioids. That's not the case with cannabis. You can stop cannabis at any point in time with no negative reaction. That's really, really important. But most of the people that I know that use cannabis use it to address a medical condition, and it's the most effective way to do that. Manny, your thoughts?
I'm trying to think of a better way to say it. There's not much. It's again, to your point, people get addicted to the relief, not the actual product. And you don't get onset of withdrawals or anything if you stop. You do get an onset of your symptoms coming back from your previous diagnoses, which is going to push you to want to get that relief again. So
Right.
I would say no, they're not addictive in the sense of going through withdrawals, but yes, they are addictive in the sense that you get relief.
Yeah. I think that when you have a medical condition and you work very hard to find a solution to be able to manage it, and that doesn't mean you get rid of it. It means you, like in my case, I'm not going to get rid of my herniated discs, but if I can keep it to a pain level of 1 or less, I'm a happy camper. And that's something I'll go back and use. And as I mentioned, I've not found anything better to work with. And in fact, many pain management doctors send patients to me for that exact reason. They're looking for a clean way of providing relief for their patients where they know the patient's not going to die. And that's really the key. Nobody's ever died from using medical or recreational use of cannabis. That's really, really key. Manny, this fits into this next question, which cannabis products can help prostate bladder pain? Pain is pain, whether it's in the prostate or whatever. So really, there's a number of products. Why don't you mention the products that start with the terpenes, Manny?
Absolutely. So first off, I would always look for products that are high in B-caryophyllene. That's a great analgesic and it's a terpene that reacts like a like a cannabinoid does, meaning it reacts with your receptors more than any other terpene. So it really helps with inflammation. It helps with pain. You could take it as a tincture. You can inhale it and use a tincture. You can even use some of what they call theragels or other type of forms of pills, if you will, and use them as suppositories, even though they don't have suppositories per se at most dispensaries anymore. And it's very, very beneficial to work that way. There's nothing that's going to hurt you that way. And it will help with the pain, primarily the inflammation, which is causing the pain.
Right.
I do recommend high products in CBD, like a 1-to-1, 50% CBD, 50% THC. And the reason I do that is because CBD really lasts longer in the system. So let's say if you were to stop, your symptoms wouldn't onset for a few days, if not a couple of weeks. Whereas as soon as THC wears off, all your symptoms really do kind of come back because it works as an opioid, but it's not dangerous like an opioid. It's more natural to
Right.
the body. So I would use anything in high B-caryophyllene, limonene there as well if it's for the daytime, myrcene and or linalool for nighttime, and very little of those two, limonene, linalool, and myrcene, if you want something balanced in the middle. But as a 1-to-1, you shouldn't get too euphoric either. Most people compare that to maybe a glass or two of wine or maybe a shot of alcohol if you partake.
Now, I do want to point out in this particular area, when you ask about what products to use, go to your dispensary and ask them for a consultation because products vary by dispensary. And the consultation, almost every dispensary offers a free consultation. You can just walk in and ask for one, and they'll give you one. And what they'll do is they'll actually home in and show you the products that they have that will help you with your particular case and your particular condition. In this case, prostate bladder pain. Manny, you've done a few consultations.
Absolutely. They're my favorite part of it because I actually learn from the consumer or the patient as well as providing education.
Mhm.
And it's a two-way street and it really allows us to hone in to see what's going to work, be as detailed as we can with you. The only thing that I would ask is not to really go into your medical diagnoses and all the medical jargon because anybody at the dispensary, to include myself, we're not necessarily medical professionals. We're not medical professionals, actually.
Sure.
We're just subject matter experts in the subject of cannabis, and we know the products better than most of the physicians because we can do the research. We don't have a license we have to worry about. At the same time, we don't want to be held liable for giving medical information. So we are very generalized. So the more personal information, the results you're looking for, the outcome and quality of life you're looking for will help us determine that.
Let's jump on to the next question. How can I tell if my current medications will interfere with cannabis? Well, first of all, as a blanket statement, cannabis does not interfere with most medications. The only medications that you have to worry about are basically medications that have to do with heart conditions. So let me walk through a few things. First of all, cannabis may affect the following medications in the following ways. If you're using some sort of a hormonal medicine, you're supplementing hormones. That would be birth control, HRT medicines, things like that. They can have a positive or a negative effect depending on what you're taking, how your particular body reacts to cannabis and the hormonal fluctuations. This goes back to the dosing and it goes back to journaling. By being able to journal, you'll know if cannabis is affecting you with respect to your medications. negatively and positively. You're not, again, the only thing you have to worry about are things like warfarin, Coumadin. Those are products that are anticoagulants. And because cannabis is endocannabinoids that are produced by your body are sent through the bloodstream to that particular part of your body that it's addressing, they can have some issues. And so the thing you have to worry about is if you're using those particular products, talk to your medical doctor and talk to your medical cannabis doctor. They can get the right prescription for you to make sure that you're using them correctly. Your thoughts, Manny?
Yeah, I apologize for that. My internet's acting a little funny, but absolutely, and I completely agree with that. One other resource I like to provide is Penn State College of Medicine.
Mm-hmm.
They had put out something that where you could type in whatever you need to type in as far as your medication, and it'll give you the contraindications of what other medications might interfere with it. It's a great resource. I'm sure we'll get it with Mark if he doesn't already have it to give
Well,
out.
we'll put that link in the email that
There
you're
you
going to
go.
receive after this particular webinar. So when you get that webinar that has the link to the video to the presentation, we'll also have a link to Penn State that can help quite a bit. Now, the other thing I do want to point out is cannabis does intensify the effects of alcohol. So if you're taking alcohol with cannabis, that alcohol that you're taking will be multiplied or it'll be multiplied by either 5 to 20x. So be very, very careful using cannabis and alcohol because candidly, the alcohol will get you drunk long before the cannabis will get you stoned. Your thoughts, Manny?
Yeah, and you're absolutely right. And to clarify that, I like to express to consumers and patients, there's a reason why they say high and stoned, ironically. So if you're stoned, usually you're using an indica product or something heavy in myrcene, linalool, you're stoned, you're locked in the couch, you're not moving anywhere. Whereas if you're using a sativa product, more uplifting, more cerebral rather than body, you're high, you're uplifted. So
Right.
just a little tip for tat and to get people to understand.
Yeah, and as I mentioned, I was at a party with a friend of mine who was not listening, and he was taking cannabis and alcohol, and we talked about how it affected the alcohol was being affected. Literally about a half hour later, the guy was not only just asleep on the couch, we had to kind of carry him upstairs and leave him there for the night. It will affect, depending on your body, it can really affect you. So just be careful of those particular areas, and I hope this answers this particular question. Now, live questions. Would you please tell me what is the shelf life of tincture oil? I have a good quality one-to-one oil kept in the refrigerator for 3 years. May I use it? Thank you. Manny, I think this is right in your area.
That is a great question. And the answer is possibly yes. So the shelf life of a product can have tremendous amount of time, especially if you're keeping it in a refrigerator, you don't have it in direct sunlight. And if it's a tincture, the only thing I would be cautious of, hold it up, see if you can see through it, see if you have any floaters in there. Because the only thing that would really contaminate it is if you're using the dropper and that dropper touches your lip, or if it touches any of your mucosis and you put it back in, then that can fester and create bacteria and otherwise.
Right.
Typically, I tell most of my clients not to keep product for more than about 6 months to a year, depending. You'll notice the oil will turn darker, and that's the cannabinoids, particularly THC, converting into CBN, which is not bad for you. However, it would have significantly different effect than what you're looking for. So
It changes the
start low,
medical
go slow.
characteristic of the product, is what you're talking about.
Right. Absolutely. So always go low, start low, go slow, test it out. But if you don't have any floaters in there, the oil still looks pretty much clear, light the way you purchased it, or even if it was a little bit dark when you purchased it. If you don't see many changes, I personally would try it at a low dose, maybe a quarter of the dropper, and see, and you'll probably notice a difference in efficacy. But if you're keeping it in the fridge, it's dark, non-contaminants, should be good actually.
Yeah. Yeah, I have used products that are actually more than 3 years old, keeping them in a refrigerator and keeping them in a cool location, and they've worked effectively. Now, I have noticed, as you mentioned, we've converted some to CBN. The profile, medical profiles changed slightly, but the main terpenes stay in place, and that's what's really, really cool. So I think we've answered all the questions. Here's some resources that you can use to be able to find out more information and get help. Naturally, our marijuana aware educational process, which is our YouTube channel, has a number of videos out there. This video will be out there by the end of the week, and we've got other webinars that you've seen, and of course, marijuana aware for the webinars. If you're looking for a card, medical marijuana treatment clinics in Florida, I highly recommend them. Not just because it's getting your recommendation in the registry. They have support. They have an online dosing center. They have webinars like this. They have a patient journey email system that they go through that can help quite a bit. And of course, I do want to point out there's another resource called the Blunt Joint, Manny, which you can help people.
Absolutely. Yeah, absolutely. I thought I was muted there for a second. Absolutely. And again, you can find us at the bluntjoint.life. It's all free. We offer telecommunications. So wherever you're at in the world, we'll be happy to set up an appointment, depending on the time zones, obviously, and make sure we could get you that information. I'd also like to say thank you, everybody, for attending and paying attention. If you stayed on, even if you didn't, everybody has something to do. We'd like to share our information. So please feel free to reach out. Just remember that this is really a journey. Take your time with it. You don't need to dive right in. Even as a veteran myself, knowing as much as I do, when I first started in dispensaries, was a little overwhelmed, had to take a step back. I actually thought I didn't have to journal. I really did need to journal and made a huge impact.
Mhm.
This helped me throughout my life as a Army veteran and dealing with all kinds of situations. So we like to share that. Please feel free to reach out, and thank you again.
Right. And thanks everyone for joining us. I would like to invite you to join us next week for our methods of medical cannabis. We're talking about routes of administration. Naturally, next week we also have our live seminar at the Villages on Thursday. So please join us for that. And then, of course, going through the whole process this particular quarter is really important. Thank you very much for joining us, and we look forward to seeing you again next week.